Holly with woodlandshits.com, and I have Dr. Mark Moran with Kalypso Wellness Centers here in the studio. I'm super excited about you guys. You guys just joined the community just recently.
Yes, correct.
Tell me a little bit about, one, what made you decide to come to this community? And then two, tell me about what Kalypso Wellness Center is.
Okay, we decided to come to here mostly because there's patients that are suffering from diseases here. Kalypso Wellness Center is a center to do ketamine infusions for people that suffer from many different ailments, including nerve pain like shingles or sciatica, inflammatory pain like arthritis. It works very well for depression and PTSD. It also helps with shingles, fibromyalgia, anxiety, migraines, headache, many different things.
Wow. And so how long, so tell me a little bit about what a ketamine infusion is. Like, what does that look like for a typical patient?
Well, the patients will come to our clinic. There'll be a medical review of their history. So we'll find out what medical problems they have, what surgery they've had, what medicines they're taking, and what their goals are for the treatment. So each infusion is individualized for the patient. It's not like a stock infusion. Everyone gets the same one. We have 5 patented formulas to treat 5 specific problems based on your individual needs and wants. Okay. So they'll come in, we'll take a history, we'll decide if the patient wants to do it. Those consent forms they sign, and we disclose and answer any questions they might have. They'll end up getting an IV, and then they'll sit in a lazy boy chair for the next hour and enjoy and relax.
That sounds amazing right now.
It doesn't hurt at all. They'll get their infusion. We watch them with video monitoring. We come in every 5 or 10 minutes to take their vital signs and make sure they're comfortable and safe. And then we'll slowly titrate up the infusion as tolerated until the end of the hour. And then we'll titrate it back down. And then we watch them for about 20 or 30 minutes afterwards to make sure they're okay before they go home.
So are there any like typical side effects? I mean, I'm sure everybody's different, but are there any side effects of having a ketamine infusion?
Sure. Ketamine is just another medicine, so there are potential possible side effects. Usually those include people describe a feeling of floating or lightheadedness. People describe vivid dreams. People describe hallucinations commonly. Nausea is a side effect, but it's very rare. The way we use our infusions, we've kind of optimized infusions to minimize that.
Okay.
And all of those are well expected and transient. They do not last very long. Once you turn the infusion off, it's about 15 or 20 minutes till those may go away if you even have them.
Okay. So I know you spoke a little bit about the different types of ailments that this helps with. Are there any that, work better than others? Or again, is it all it just depends on the patient?
It really works well for all of those.
Okay.
And it really depends on the patient's severity of disease and what their goals are for treatment to seeing how well it works. So, everyone has tried physical therapy, and some people say it works great and some people say it doesn't work very well. People have tried medicines, and some people say that medicine worked great and doesn't work very well. So ketamine is just like that. Some people will say it works great, it's phenomenal. There will be some people that say it doesn't work. Our research has shown that about 80% of people will get some benefit.
Okay, and that was my next question.
Right. It's not a guaranteed thing. It's just an option to help patients that have tried lots of other things and aren't getting any other benefits.
And, could this treatment have an addictive ailment to it? Or, I mean, obviously you're administrating it, in an office, in a center, so it's not like they can take this stuff home or anything like that. It's all done within the office. But are there any, addictive?
Correct. So I'm a pain physician. I've been practicing for 10 years, and my partners as well. And we're very used to dealing with narcotics and potentially addictive medicines.
Okay.
So when we incorporated ketamine infusions into this practice, we knew that there is a potential for addiction, but consequently, we give very, very low doses and minimize those risks because we're properly trained in giving ketamine.
Well, that's awesome. And I think this is going to be such a great addition to this community for all the people that are having all these ailments that don't want to take the traditional drugs, that don't want to have, the morphines and the Vicodins and, all of that. And this is just another way to get relief from their symptoms.
Correct. It's really a groundbreaking option here that's come to our fruition. People don't know about it, which is why we're trying to spread the word and promote education, because the vast majority of people that come in and do a treatment will get to feeling better.
Well, I think I need to come and check out Kalypso Wellness Center. I'm just saying, just to sit in the Lazy Boy for an hour, mom of 3 sitting in a Lazy Boy for an hour isn't that easy. So that would be amazing for me. So if listeners wanted to get more information, educate themselves a little bit more on ketamine infusions, Kalypso Wellness Center, what's the website that they would go to?
It's kalypsowellness.com, and Kalypso spelled with a K. Mm-hmm. There's tons of literature there saying the benefits of ketamine, and there's all kinds of frequently asked questions. There's all of our locations. There's a phone number you can call. There's Facebook links. So absolutely, knowledge is power, and we encourage our patients to make educated decisions. So educate yourself. Call us or come by and just talk to us. You absolutely do not have to get an infusion, but just come by and meet us and see what we have to offer, and then you can make an educated decision as if you want it or not.
Okay, great. Well, and I'll make sure that I put a link on the video for people to just click through and make it easy. Is there anything more that you'd like to add to this interview to educate the listeners, or anything more that you want to include?
Sure. We're very excited about the potential for ketamine, not only with the disease states that you mentioned, but future states as well. So there hasn't been any change in cancer pain treatments for decades. Okay. Patients that are going through cancer inevitably have pain and depression, especially if it's terminal cancer.
Right.
Unfortunately, those patients frequently get high dose narcotics, and then they can't enjoy their final days with their family. So now imagine we can give them a ketamine infusion,
Brilliant.
Which proves that narcotic requirements are decreased. So consequently, not only will their pain be better and their side effects will be better, they'd have more energy, and then they can enjoy spending time with their family instead of being too sedated.
I love that idea. That's amazing.
That's
brilliant.
The other thing we're very excited about is the chronic traumatic encephalopathy angle. So the research just came out recently where 99% of NFL players have chronic traumatic encephalopathy. The movie Concussion with Will Smith was about that.
Oh, yeah.
And we know it works very well for depression. We know it works very well for PTSD. And we know it has a great anti-inflammatory agent. Mm-hmm. So we are in the process of starting to work with NFL players to drastically decrease the risk of progressing to chronic traumatic encephalopathy. So imagine in 5 years, all the college or high school or football players once a week or once a month came in and got a ketamine infusion, and that would greatly reduce the potential that they would have chronic traumatic encephalopathy developing.
That's huge.
Right?
I mean, all of it is.
Yeah. And then the last thing that we're excited about, which is early phases, is we know that ketamine helps with addiction problems. Oh. Patients that are taking hundreds of milligrams of morphine a day are able to stop their narcotics overnight.
Really?
So imagine if we implemented this with smoking cessation. Mm-hmm. We could drastically decrease the chance of smoking or being addicted to tobacco.
Wow. You guys are moving mountains. I'm just saying. Yeah. Some pretty amazing stuff.
As far as patient testimonials, we have a Vietnam vet that had PTSD nightmares for 40 years. He simply can't go to sleep. He's tried everything available through the VA and is unable to get any significant sleep because of his nightmares. He came in about 7 months ago and had 1 infusion, and since then has had no nightmares.
Oh my gosh.
So consequently, his quality of sleep is much better, and then it's a snowball. His sleep is better, so his energy level is better, his emotions are better, his quality of life is much better too. And what's really fascinating about that is, unfortunately, he was behind a car accident recently. And the guy in front of him he flipped his car and wound up being thrown and ejected from his car.
Oh my God.
So he went over to help the guy out who was face down. He flipped the guy over and had an open chest wound. You can't get a better simulation for Vietnam trauma than that.
Sure.
He still doesn't have any nightmares after that.
Wow.
So it works phenomenally well for PTSD. For our wounded warriors, the medical center in San Antonio frequently gives ketamine for wounded warriors or suicidal warriors because of how quickly and well it works. Another story I'd like to share is we have a patient, a 13-year-old patient coming from Phoenix, Arizona, and she was coming and being treated for depression. And after 2 infusions, her mom came in crying because she says, after 2 infusions, my daughter is smiling. She's more focused at school. Her grades have drastically increased. She's interacting with her peers more, and she's just a happier teenager.
Wow.
So what better compliment could you get
Of
than
course.
helping out someone, especially a teenager who's dealing with depression, than a parent who really sees the benefit of taking care of their kids?
Wow. Those are very, very impressive.
And we have dozens and dozens and dozens of testimonials on our website about how drastically this medicine is improving patients' lives.
I'm speechless right now. Well, Mark, thank you so much for coming in and sharing this amazing information. I know I'm super excited to see, Kalypso Wellness Center do amazing things with ketamine and with all the people in our community and all over, for that matter. So I'm excited that you guys are here, and thank you so much for coming into the studio and educating us a little bit about what you guys are doing.
Absolutely. We're happy to talk anytime. We just need to spread the word about what this amazing medicine can do and help people out.
Well, I'm happy to help with that.
Thank you.